Hi, everyone. My name is Jane Hahn. I'm a licensed clinical social worker with a private therapy practice in Silverthorne, and I'm super excited because we've partnered up with Public Health to provide you guys some extra mental health support services right now. And I just wanted to take a quick moment to introduce myself and my team and tell you a little bit about some of the things we're going to be offering and just send out a few invitations for you to connect with us and learn more about our services. So there's two ways that we are going to be moving forward and offering some support to you guys through this really difficult and strange time that we're all in as we're trying to sort out work and family and our futures and finances and our life. The first thing we're going to be doing is running educational workshops during your Wednesday morning meetings. So you guys will already be together, and we're going to be talking about mental health, mental well being, managing our work life balance, working through some burnout, some fatigue, Zoom fatigue, which I know a lot of us are having. We're going to be talking about just how to manage our mental health during this time. So I will be personally running these. I would really love them to be useful for you and to be good use of your time. So feel free to email me. I will send you out my personal email for suggestions about ways that I can best provide information to you and your team. The other thing that we're going to be doing is offering individual sessions, one-on-one coaching or therapy sessions with a licensed clinician. So I have two clinicians on staff. They both have availability as early as this week or next. And this will be a time for you to process through anything that we're talking about in the workshops, any of the skills that we're learning or any of the strategies or tactics that we're working on. But it will also be a time for you to talk through any individualized issues that you're having with family or work or depression, anxiety. There is a lot of grief and a lot of loss that is happening during this time, increase in addiction, increase in conflict. So this will really be a time for you to sit down with somebody and get all the support that you need around those individual issues. They're totally confidential. We won't share your information with anyone. They're just a chance for you to be supported one-on-one. I have two really great clinicians on staff right now who have availability. The first one is Jane Ambro. She's also a licensed clinical social worker, and she does a ton of work with anxiety, depression. She works a lot with grief, relationship issues, anger, chronic illness, and chronic pain. She'd be a great fit if you would like to see a woman. We also have Harry McNamara, who is a licensed professional counselor and a licensed addiction counselor. And he also has done a lot of great work with depression, anxiety, relationships, big life transitions, big life changes. He also has the addiction piece. So if you or somebody that you love is struggling with an addiction, whether that's to a substance or a behavior or technology, he might be a great fit for you. We're trying to make it incredibly easy for you to get in and see these clinicians. So your EAP will be paying for your first session with either Jane or Harry. So all you need to do is shoot us an email or give us a phone call, make sure that you have our information, and set up your first appointment. If it's a good experience for you and you want to continue your session work, we do take all the Peak Health Alliance insurance plans. So you can continue your work with your clinician for as long as you need to be supported on as many different issues as you need help and support with. So again, those two clinicians are available as early as this week or next. I will make sure that you have our practice manager's email so you can reach out as soon as you'd like to. I will see you all next Wednesday for our first educational workshop. And I've sent Whitney a few prompts for you to start either thinking through or writing about so we can start to get the juices flowing about some of these conversations around our mental health. We're really excited to be working with you guys and to meet you. And please reach out with thoughts or suggestions. Thanks so much.